Hello, and welcome to QETV Live Show with your host, Miss H. This is going to be a very informative show today. So because of all the information that we will be sharing on today's show, I just strongly encourage you to gather around your social media, call someone, let them know that we will be talking about mental health. We will be talking about, what to do as far as warning signs, possibly some preventive care, and then where you can go to get assistance and help, or just know that all your mental checkup is A-OK. It's nothing wrong with just having the information and being aware of what's going on. Remember, we bridge inspiration with information for everyday life. We're here live every Thursday on Vox Wave from 1:30 to 2:30 p.m. Eastern Time. Yes, on Thursday from 1:30 to 2:30 live on Vox Wave. What an exciting show today. We will bring up our guests in a few minutes, but right before I bring up my guests, I just want to pretty much kind of entice you, throw out some information and some things that I want you to start thinking about to see if you can maybe do a mental health checkup, almost like a little quiz. And I want you to just think about some things that I'm about to share, because we will dig a little bit deeper into these topics. But right now, I just want to ask you, when is the last time you've had a mental checkup? You know how we're always going to the doctor and we get our physical checkup? And some of us are behind on that. Yes, you should have your annuals, your checkup, men and women. A lot of time the men, I don't want to get too hard on you, but sometimes, your wives or your significant others have to drag you into the doctor. Just a little short story. My husband had his annual yesterday, and I didn't go with him. I usually go with him. For the last 3 years, I've been going with him because I needed to make sure he goes. So yesterday, I didn't go with him. You know what he did? He had Dr. Brock call me, and she said, I just want to give you some good news. And I said, what is that? Oh, his blood pressure levels are A-OK. His vitamin D levels. And, she went and named down some things where we had flagged them a year ago. And I could just hear him chuckling in the background. I said, Dr. Brock, did you call me on your own? And by the way, he had just lost 5 pounds. So she said, no, he had me call you. I said, I knew it. I said, he just wanted those bragging rights. But it's okay, as long as the report was good. I was really pleased and I was happy. But I told her, I said, but let me share, since he put me on the spot. I know I'm putting it out there, but just to kind of make it humorous, because you can make this a part of your commitment where you can have someone else make you accountability partner with your physical, mental health. The more people you bring in and help you to become accountable with your life, you know what? You can allow others to help you to prevent things that could happen to your life and for others, because when something bad happens, we don't realize how many other people we affect their lives. But anyway, I says, now I'm just going to tell on him. And this is why I'm sharing this, because I'm bringing in my personal story, but at the same time, it's also to help push you and motivate you to check on these things for yourself. I says, there is a such thing as preparing for your checkup. And she said, what do you mean? I said, about 3 weeks ago, he started going to the gym. He started getting rid of salty and sweet stuff, so that when he came to see you, she laughed and she said, that's funny, because my mother does the same thing. And I said, so she says, but that's okay, Miss Hightower. It's okay. The good news is we just want a good report. And she says, a year from now, if I don't see these same results, now that I see very good results prior to last year when he was on the borderline, she said, then that will show me whether or not he has the ability to continue with his physical healthy checkup. I said, okay, so that's good news. So again, so good news, champ. I'm so proud of you for that good report yesterday. But again, back to today's show, it's time for your mental health checkup. And in preparing for your mental health checkup, I just want to throw up some things to ask you some questions really quick. I want to find out, as you can see, let me look at it up here. These are 5 things that I just quickly looked at. And if you are in any of these categories, then we need to talk, or you need to call in today. Have you noticed, or have you been experiencing grouchiness lately? You know, beyond, your norm. We all get a little grouchy when we get up in the morning or we get deprived of sleep. But, something that's a little bit abnormal. Normally, you are a happy person, but lately you find yourself blowing up over small things. Sleeplessness. Many Americans, I read this on the YouTube that I got this off of, it says don't get enough sleep. And sometimes I didn't even realize sleep insomnia was part of our mental psyche process, that when we don't get enough sleep, it can affect our psyche, okay? So if you're not getting enough sleep, you're having sleepless nights, you just assume that you need to roll over and just deal with it. No, you don't. That's something you really, really need to put that on your mental checklist. The other thing was having difficulty dealing with people. Sometimes, especially if you are a person that you're low key, you're calm, you tolerate people, but right now you're getting to that place where dealing with people is becoming difficult, or you just get really hyper, or you just get withdrawn when you are in a crowd or around people. So that's something to check out, because we don't want that to lead to depression. So again, these are just some checkups, and we will talk about them later in the show. Eating, oh my goodness, that's when I always check. This is my first sign. If I'm eating too much, I never have a problem eating less, but my challenge is eating too much. But one of the mental health awareness challenges in the 5 that I've looked up is that if you're eating too much and it's above normal, beyond what you normally eat, or you're not eating at all, or loss of appetite. Sometimes you can lose appetite if there is, something major going on in the family, or death going on in the family, or, if you experience sudden bad news. We can understand that, but we're talking about something a little more excessive than that. And the other thing, if you can't relax, we all need them R&Rs. This is summertime. We should be out there enjoying the sun when we're able to, and we should have some time that we carve out for ourselves. If you're always wounded up and your mind is racing, and irritability, and you're just full of anxiety, these are somewhat pre-signs and pre-warning signs that you might just want to begin the conversation. You know what I mean? Because sometimes these things, you're getting upset, you have excessive headache, you're breathing, having heavy breathing problem, or one of the things, and these are sometimes symptoms in children, where their stomach is always knotting up or stomach aches. These are some things that, you want to look into. And last but not least, the 5 steps to better health, and we're gonna even talk about that, is that, getting organized, getting social, getting a social life, trying hobbies, self-care, staying busy, and talking to someone. These are things, we can take this down now. These are things that I just wanted to start this conversation, but I'm not a doctor, okay? I'm not a doctor, but I brought a nurse practitioner here, someone that is certified, that can dive into this subject of your mental health checkup and give you some medical terminology, give you some medical diagnosis, or share some things that could, if you're good, to help keep you out of the red. But if you are, having some pre-warning signs, to help guide you to get the information you may need, or come and see her. Or if you're already stuck or you already are experiencing these signs, show you where you can get some help. So no matter what stage you are in, there's help, there's hope, and there is someone there for you. We are our brothers and sisters' keeper, but before we can be their keeper, we have to first learn how to take care of ourselves, so that with a healthy heart, with a healthy mind, and a healthy body, we can have a productive life. We can live healthy lifestyle. There's 2 proverbs, wise sayings, that I love very, very much. And one of them is, as a man thinketh, so is he. So it's all about sometimes how you're thinking that will determine where you will end up in life. Death in life, in the power of your tongue. You can choose to live a healthy lifestyle, or you can choose to go in the opposite direction. The other wise proverb that I love is that, guard your heart, because out of your own heart, and I'm talking about your mind, flows the issues of life, meaning that every good thing come out of a good, sound mind, not one that is full of care, anxiety, depression, and full of doubt and fear. These are unhealthy things to incorporate in your daily life. But when you guard them, when you set up barriers so that these unhealthy, toxic thoughts can't come in, then you can live a very productive life. But again, I'm not a doctor, but I have one here for you, a certified nurse practitioner. So don't go anywhere. We'll be right back after the break. Hi, and welcome back to QETV Live Show with your host, Miss H. I just wanted to kind of wrap up and bring to you Sabrina Sepulveda, and she's my special guest co-host today. We just finished talking about, right before the break, how to do a mental health checkup. But again, like I shared, I only just kind of scratched the surface. But what I want to do now is introduce to you Miss Sabrina Sepulveda, and let her share her story, how she got started, who she is, and where her practice is. So help me welcome to the show, Sabrina Sepulveda. Hi, Sabrina.
Hi, how are you?
I'm doing well. I just wanted to introduce you to the audience out there and to Facebook Live and get a chance to talk about one of the leading topics today that is really rocking our society. We see it everywhere, things, and the thing that bothers me and really is causing me to be a little more alert is that you always hear, "I wished I would have known." And I don't want us to have those type of stories if we could do some preventive. So before we start there, just introduce yourself, tell everyone who you are and how you got started in your practice.
Great. Well, thank you so much for having me here today.
Sure.
Again, my name is Sabrina Sepulveda. I'm an adult psychiatric nurse practitioner. I practice in St. Mary's County in Leonardtown. I do have a private practice there. I focus on treating adults with mental health conditions.
Okay.
I primarily do psychiatric evaluations and medication management, so prescribing medications to help with psychiatric conditions. I also do some therapy practices for individuals as well.
Oh, okay. You do quite a bit there. Now, how
It's
did you?
the holistic approach. To
It's the whole. Oh, I love it. The
person.
holistic, and that's what we need, because years ago that holistic approach was only designated, or people made us feel like something was wrong when we tried to seek help mentally. We only went to the physician when we needed to do our annual checkup, or we were going on a trip or going out of the country for our passports or something like that. But to actually do a holistic approach of our spirit, soul, and body, it was kind of taboo. So tell me how you got started, like,
Sure.
when you grew up. What did you know this is something you want to become?
No, before I went to nursing school, I thought I was going to be a midwife.
Oh, okay.
And I went to nursing school on the premise that I was going to be a nurse and then get an advanced degree as a midwife. I saw my first birth as a student. I think I was about 21 years old.
Aww.
And I was holding the leg of a strange woman as she gave birth, and I cried more than the family. And I said, "This is a miracle.
Yes, it is.
Can I witness a miracle every day of my life? What if I was irritable? What if I was having a bad day and this is the most important day of people's lives?" I said, "I don't want to witness a miracle every day. What if it dampens the quality of it?"
Yes.
So then I didn't know what I was going to do. But I was on a full scholarship to the University of Maryland. You don't want to mess that up, right?
Okay.
So my next rotation in nursing school happened to be in forensic psychiatry, of all things, for individuals who have some clinical component to their mental health condition. And I was placed at a specialized hospital here in the state of Maryland that treats individuals, and I found my niche. I I found what.
So no more midwife
No
and
more
the
midwife
miracles.
yeah, can't witness a miracle every day.
Uh-huh.
Just being, learning about people, learning about their condition, learning how to help people, and the journey that they take throughout their life. That's why I prefer to be an outpatient practice, because I get to see people over time.
Okay.
Versus an inpatient, like an acute, there's some specific reason why they're there, suicidality or something like that. I like to see people over time, so that's why I chose outpatient practice in psychiatry, to have a relationship with people.
Okay, so you're a graduate of the University of Maryland,
That's
where
correct.
you got your start. My daughter graduated from the
Great.
University of Maryland. So I'm familiar with very rough program. It's not easy coming through.
It is a
highly competitive program. And the beauty of, like you said, the midwife, my daughter-in-law, she used a midwife. And then there's the other one called the one that comes into the home that help with the holistic of having a baby.
Like a doula?
A doula.
Yes.
She had a doula, and she had it with her last two. And my son said it just everything that they prepped him for happened. So you're right. You get to witness a miracle every day. So now you had this aha moment with the forensic psychiatry. So when you stop there, what caused you to pursue to become that nurse practitioner? Because you're still not quite there with all the degrees behind your name.
I did work for about 8 years as a nurse, and in nursing I worked in several different types of fields. Case management, I also taught for colleges, the community college level, and for the University of Maryland as well. And mainly my case management was individuals who had chronic mental illness. That was the specialty that I had, and also supported individuals who had developmental disabilities along with their mental health co-occurring illnesses. So from there, I went on to graduate school, again at the University of Maryland, because they are rated number 7 in the world.
Yes,
so
they're very highly rated.
Nurse practitioner program, so the right place to be. And then following that, I worked in psychiatry in an outpatient capacity.
And I noticed that your degree, and we're trying to get this all established because I want you to see that she's qualified to do what she does. I noticed that as a nurse practitioner, a certified nurse practitioner, is different from a registered nurse. And I also noticed that a lot of people now are becoming physician assistants.
Correct.
What's the difference between a PA and a certified nurse practitioner?
So a nurse practitioner does have a background in nursing like I do. So I was a nurse first with a bachelor's in nursing, and then I went into a program. And nurse practitioner programs are usually specialized by an area. So psychiatric mental health may be one of them.
Okay.
Family nurse practitioner may be another one. You might see those in your primary care offices providing internal medicine or primary care. There could be acute care nurse practitioners. So they have a specialty. All nurse practitioners are able to prescribe medications. There are differences by state about how independent a nurse practitioner can be, but in the state of Maryland, they are independent licensed practitioners. And when you finish your degree program, it's either a master's degree or a doctorally prepared degree program for a nurse practitioner. Then you sit for a board certification exam. So there are different certifying bodies within the country that would certify you in your specialty. So that's where the board certification is as a psychiatric nurse practitioner. That is my specialty.
Now, unlike a PA, for the state of Maryland, do you have to have oversight, a doctor to oversee your practice?
No, Maryland is independent, so nurse practitioners are independently licensed practitioners who can operate their own business like I do, or work in conjunction with other members, but they're their own body, their own individual. A physician's assistant does require supervision by a physician, so that's different. And their educational tracks are slightly different. They do have a bachelor's in some other area, and then sometimes the programs are master's or certificate programs. PAs also sit for national certification exams. But in the state of Maryland, they still are supervised, and the what we call credentialing. So say a physician assistant works in the emergency room and may need to do sutures, that they would be credentialed by that supervising provider, that they are skilled at that particular task as a delegated task under the license of the physician.
So they still can see the patients. Absolutely. Just like the doc, because I notice
and write
now
prescriptions
and write prescriptions
treatment.
Because I notice now when you go see your primary care physician, they now put the PAs out there to help them, I guess, so they can see more patients. But I noticed the PA was, writing medication. So as long as they have oversight, they can fill those prescriptions, write those prescriptions. And you can, as a certified nurse practitioner, can write prescriptions as well. Now, do you have to have oversight with a psychiatric doctor for giving out, those highly qualified drugs when you see the mental ill patients?
Not in the state of Maryland. In the state of Maryland, I do not have to have a supervising physician, nor do I have to have, they had a process called an attestation that said a doctor said that you were okay to practice. That does not occur in the state of Maryland anymore. However, I do have physician colleagues that I call upon and ask and collaborate and talk to and ask questions of. So it's still very a collegial practice, that there are things that are beyond the capacity of a nurse practitioner, beyond the scope. And those would be things that you would need to refer to a physician for.
And the only reason I asked you that question, I'm getting all the little degrees and qualifications out of the way, because I noticed that you said for the state of Maryland you didn't need oversight. It was good news to see that when I looked on the website, Maryland was not listed, and I'm so glad, because you don't need oversight. So Maryland could have been listed on that list of opioid drugs, where it had the top 10 states that actually opioids was flooded into these top 10 states, because these certified professions and doctors and pharmacies were just prescribing all of these opioids. So without you guys having oversight, and with Maryland being one of them states, it's just good to know that Maryland has regulations that it did not flood into our state, because I could easily see how we could go under the radar by us not being, having, you guys as certified nurse practitioner do not have oversight. So that's good news to know that you guys consult others.
Recently, there was a change in what's called Data 2000, which allows both nurse practitioners and physician's assistants to prescribe medications that help treat opioid addiction, which was a great change that happened to increase capacity so that people can get access to care, as we know that for this terrible epidemic.
So that's good. But we don't even want patients to have to go in that direction. What we want to do now is just get started with, I want to ask you a couple of questions that I have on my list of things to do. She has shared with us how she got started. Obviously, she loves what she does. She understands that helping people gives her a quality of fulfillment in life. This is a career choice that she chose. So what I wanted to ask you now, why do you feel that it's important that people have mental health checkups?
In our fast society, everything is fast. Everything has to be instantaneous. I think we're losing some of who we are as people. We're not slowing down. We're not taking time. We're not being with people. We're not talking to people.
Yes.
We're not looking people in the eye anymore.
That's true.
Everybody's on a screen. So I think that's what's important about mental health, and seeing a person to be able to differentiate where you are and connect.
Do you feel that disconnect, even with the new technology age, that next wave generation of people that are coming up, you will see some behavior challenges?
I think we'll see a lot of difficulties with communicating.
Okay. What is the drawback for parents that do not put time limits? And not just parents, adults too, but we do know that with teenagers and young adults in college, if you do not begin to build your social skill life, what are some of the things that could happen as far as behavioral health?
I think one of the biggest things is our impulse control. When everything is instant for us, you push a button. We want instant gratification. We don't learn that things take time, or skill building takes time. So our frustration tolerance goes way down, which contributes to our irritability. And then how do we interact with others? You know, how do we get that connection when we're not talking to people anymore, or there's a barrier? There's a barrier between us. It's as if there's a wall between us, versus like we're sitting here, we're communicating, I'm reading your facial expression, I'm reading your body language. How does that translate in a text form? Haven't we all gotten a text message and not know how to take that text message?
Wow.
Because we don't have the context clues. The context clues of what my facial expression says or what my body language says. Maybe I was joking, but it comes across as mean. But if you saw me face to face, you would know that I had a gesture.
Right.
So I think that's the difference.
Wow. So sometimes even your ability to come in and see a person and, you know, take for instance, you know, example, mom brings 16-year-old in. He just won't talk to me. He's just irritable all the time. You're able to really check into and do some checking to find out whether or not that individual is socially withdrawn due to, and it may not even be
maybe
anything.
It's not getting enough sleep. Wow. Because we're so pressed with school and activities and other things.
And what about overloading a person? You know, whether you're working or a student or just, you know, just everyday life, overstimulus. And your body can't get to sleep. It's not because you got insomnia. You could be just overstimulating your body. So how do you detect all of that if I were to come see you?
So we do a lot of history taking in the first visit.
Okay.
So sometimes people will bring, one thing that we definitely need is a person to bring in any of their medications that they're currently taking.
Okay.
Because maybe you're having a side effect of a regular medication that you're taking. So that's one of the things that we differentiate for. I may order some lab tests. Do you have a vitamin level that's low that's causing your low energy? Do you have a thyroid condition?
Get out of here. So if my vitamin levels are low, it could
contribute.
Okay.
If you have a thyroid condition, that can contribute to anxiety or sleeplessness or fatigue. So those are the things I'm screening as part of my mental health evaluation, because while I don't treat a thyroid condition, it's contributing to your mental health. And maybe we need to fix that first and then see what the outcome would be. So a lot of times we're teasing apart a puzzle. And I'm taking in a lot of information and to be able to tease apart that puzzle to find out what the root cause of the symptoms are. So do we medicate the right thing, or do we offer a treatment plan for the right thing?
See, now I like that because you have the ability to diagnose, but not necessarily prescribe. You may set a person up on a treatment plan that is without medication.
Absolutely.
Because years ago, all I ever knew is people was taking all these drugs for their mental health, and come to find out sometimes it was just really nothing wrong with them. Like you said, low in maybe a vitamin or mineral or thyroid problem or lack of sleep, but yet they're taking all this medication and then it's deteriorating other organs in their body. Okay. Now I want you to share with me, I looked up some other things.
Sure.
How do you approach and what does these terminology mean?
Okay.
The difference between emotional health, behavioral health, they used this CBT, DBT, and ACT. I thought maybe this was like taking a test in school, ACT.
Yeah.
What is the difference between emotional health and behavior health?
So emotional health has to do with emotional regulation, but behavioral health would include both emotions and behaviors that would be associated with it. So think about your emotions might be happy or sad, but is there a behavior practice that goes along with it? You're sad, and then you withdraw from others. The behavior is withdrawing, right? The emotion is sad. So oftentimes we use them interchangeably between emotional and behavioral.
So they're not synonyms.
Could be.
Could
but
be.
There's an additional component in behavioral health encompassing the entire, looking at the entire person.
Okay.
Not just an emotional symptom.
So on a behavior action is stemming from an emotional, could be an emotional problem, and that emotional problem could be a sign of some type
behavioral
of
dysregulation.
So you have to take all this information and pretty much score it and then come up with a treatment plan.
Absolutely.
How long does this process take?
So the initial appointment meeting with a psychiatrist or a psychiatric nurse practitioner should take about 45 minutes to an hour.
Okay.
And in that time, you're going to go over what symptoms brought you here, what you're currently experiencing. The practitioner may ask you to fill out some screener questionnaires that would kind of highlight some of the symptoms that you are having. That could help give them a guide about where they need to focus. They're going to go over any of your past psychiatric history. Have you been treated by a provider? Have you seen a therapist? Have you taken other medications? Have you been in the hospital? Have you had substance abuse problems, because they may influence your mental health?
Okay, so the substance abuse could add to...
Absolutely.
Okay.
So we go over past psychiatric history. We focus on your medical history, because maybe you have a disease state that contributes to depression. Chronic heart disease can contribute to depression. Chronic pain often has depression linked to it. Sleep apnea, obstructive sleep apnea often has fatigue associated with it. So we do take a medical history and what treatments you're taking for those. People may have fibromyalgia, and we may use an antidepressant to treat fibromyalgia. So the medical history is also important. In addition to that, your family history is important, because there can be a genetic underlying for your condition. Sometimes I say you came by this honestly. It's in your genes. That doesn't, having a family history doesn't predestine you to having a mental illness.
Okay, that's good news.
That's good news. But when you have an underlying genetic propensity for an illness, and then you have traumatic events or things in your environment, they can turn on gene sequencing, which could affect a change. Think about any kind of environmental stressors that would be in the environment, radiation or something like that would change your DNA, could lead to a turning on of a gene sequence. Trauma is a high likelihood of having, whether there's abuse, neglect, sexual assault, some trauma has happened, that can also put you more at risk for an underlying genetic condition, particularly for children.
So a mental health checkup is not just for the sake of getting one. This is really serious. Yes. We all need them just to see where we are, to locate ourselves in life. I like that. Did you hear that? Just having that self-awareness, because Sabrina has brought in so many components of mental health that I haven't even thought of. You know, like you said, your genetic genes does not necessarily mean that mama had it, daddy had it, I'm going to have it. But if I don't start watching some of those same patterns and behaviors, and I can do some things, or trauma can begin to bring that up and allow those things to get stimulated in me, now I got a problem that I didn't even know I had, but because some traumatizing experience kind of brought it out in me. That's really vital right now. What we're going to do, we're going to go on a station break, and when we come back, we're going to pick up from there. But before I go on that station break, I want you to pick up the phone and call someone and let them know you're watching QETV Live Show with your host, Miss H, and with our special guest co-host, Sabrina Sepulveda. And this information is just so enlightening, because we want everyone to thrive in their life. We want everyone to have a healthy lifestyle. And the only way to do that is to find out, locate where you are. And the only way to keep it, if you already have it, you want to continue in it. So again, we want to just continue to make you aware of some warning signs, or bring you, have you aware of helping someone else, because maybe it's not for you, but maybe you may be the answer to someone else's life. So don't go anywhere. We'll be right back. I'm going to play a clip just to introduce you to Sabrina, okay? QETV would like to welcome Sabrina Sepulveda. Sabrina is a board-certified adult psychiatric and mental health practitioner. Ms. Sepulveda graduated from the University of Maryland, Baltimore School of Nursing with a Bachelor of Science in Nursing in 2002 and a Master of Science in Nursing in 2011. Ms. Sepulveda received the Excellence in Psychiatric Nursing Award from the University of Maryland, Baltimore in 2011. As owner of Harborside Behavioral Health, LLC, her practice focused on psychiatric evaluation and pharmacological management of mental health disorder in adult patients. In addition to clinical practice, Ms. Sepulveda holds a governor appointment to the Maryland Behavioral Health Advisory Council. She serves on the board of directors for the Maryland Academy of Advanced Practice Clinicians. Passionate about teaching, she has held adjunct faculty positions at the College of Southern Maryland, University of Maryland, Baltimore School of Nursing, Bowie State University, and the Community College of Baltimore County. Ms. Sepulveda has lectured for and holds memberships in several professional organizations, including the Maryland Academy of Advanced Practice Clinicians and Southern Maryland Psychological Association on the topics of pharmacology and professional burnout. She is also a member of the Healthy St. Mary's Partnership Behavior Health Action Team and Behavior Health Case Consultant Group. Help me welcome Sabrina Sepulveda. Hi, welcome back to QETV Live Show with your host, Miss H, and with our very special guest co-host, Sabrina Sepulveda. She is a certified nurse practitioner with her own private practice. Sabrina, right now I want you to talk to the audience, because we have talked about a mouthful today, and I definitely want to have you back, because we really didn't even get into a lot of the things to do with why people are reluctant to coming to get the help they need. We haven't talked about, some of the advances that have now started happening where people now, I even heard that there are webinars that you can go online. And now, do you advise that people find certified nurse practitioner and do things online because they
for access to care.
Unfortunately,
there is a nationwide shortage of mental health providers, particularly prescribers.
Oh, really?
Across the country, and certainly in my community in Southern Maryland, we have a definite shortage of healthcare providers. So I think access to care. There are practices that do telehealth and telepsychiatry.
Yes.
And even our large practices like the VA employ telepsychiatry as a way to get access points to people. So I think as long as you have a qualified provider and you have secure access to the individuals online, that I think access to care is better than no care at all.
Oh, I like that. I love that. Okay, right now, Sabrina's going to talk to you through the camera and tell you some things that she wants you to know, and definitely bring in her practice, tell you where her practice is, and give you her social media access, as well as, Sabrina, before we leave, we want to give the viewers a 1-800 number that if they need to call a hotline or something, what is it, NAMI? NAMI, if they need to call, or, you can always call 911. That's the quickest way to get the help. But we just want you to know that, an ounce of prevention is worth anything. that we can right now look at people's lives who have left here and didn't have to, all because people did not recognize signs. And it starts small, but it can progress very, very big. So, Sabrina, talk to the viewers.
Yes, thank you so much, Ms. H.
You're welcome.
My practice is Harborside Behavioral Health, and I'm located in St. Mary's County in Leonardtown, Maryland, in downtown Leonardtown. My website that you can reach me at for phone numbers or email address is www.harborsidebehavioralhealth.com. I just want to piggyback on some of the things that you were talking about earlier about what are the signs and symptoms that most often bring people into care. And I think talking about those regulatory things like our sleep, our appetite, our ability to concentrate, our energy level, I think those are kind of some easy, quick hallmark symptoms that if you're having difficulty or you've had a change in those and that it's persisted, lasts for more than 2 weeks to 1 month in duration, that may be a sign that things are changing for you. Also looking at your current level of stressors and where you're at medically and health-wise, those can be some good indicators that there may be a risk factor for you coming on. Certainly, if you're struggling with alcohol or substance abuse, that will put you more at risk, and that needs to be evaluated as well. I think one of the things that is difficult for people is to come in and tell a stranger some personal information. And I just know that as a provider, this is, I really think of it as a privilege and an honor to bear witness to people's human experience. We all have struggles, and that's one of the things that I pride myself in is to really listen to the person, because in my mind, the person has all the answers. I don't have the answers, but if I listen enough to the person, I can pick out what I need to help the person with. So it's not coming from me, it's coming from them, and then a collaborative effort about where things need to go. I liked what you said earlier in the beginning of the segment about an accountability partner. And sometimes that is my role, that we've talked about an area that you want to improve in your life. We've made some suggestions. You take it home with you, but how do you follow up on those things?
Yes, that's the biggest thing.
That's a way that a provider can be say, the last time we talked about some changes that you wanted to make, and how have those been going, and have you met those goals? So I think if you look at the person as a partner in your care and not directing the care, that can be a real advantage to the patient that you have an accountability partner. Because often your spouse or significant other or friend isn't the best accountability partner. So you need a neutral person to be able to...
Especially if you got secrets.
Yes.
They're not going to always hold them, or they could sometimes add to the trauma. Because if you're holding back, say you or private smoker or drinker, and you didn't want no one to know. Because I have known people that I didn't even know they drink heavily because they hid it very well. And then all of a sudden, they come out of the closet and you tell the wrong person. That could be traumatizing. So you're right. You have to choose your accountability partner well.
That's right.
But you got to trust somebody, because you can't let the problem progress,
right?
And that's what people do.
And I think stigma is real, and I think it's still very prevalent in our country. And that's one of the things in my role is to be non-judgmental and to be neutral and to hold a safe place for people to share, to be kept in confidence with some limitations on confidentiality, harming yourself or others, abuse or neglect, communicable disease. Those are things that legally I'm bound to report, which I'd go over in an interview. But those are the types of things that I am holding confident, your secrets or your troubles, that you can share with me. And often I've treated people, I've had some patients since the beginning of my practice in 2012, and they say, I don't want to share my story with anyone else. So I'm like the keeper. I'm holding these things for the individual, and that I know them very well. And I can say, remember 3 years ago when this happened, this is how we approached it. And so it's a very personal, it is an intimate therapeutic relationship with the individual in practice.
My goodness. I don't think that would be a good practice for me. Because now let me ask you this before we're closing up. When you have to hold that many secret, almost like a priest, you're holding all of this. How do you vent for yourself? I know this is now private to you, and you don't have to answer this question. How do you release? Because
That's a good question.
Imagine.
I have to practice what I preach.
Oh, okay.
So I have a couple of tricks and strategies.
Okay.
I'll tell you a few that I do. In my previous job, I had about a 45-minute commute home. I would allow myself to think about my work, think about my patients. Did I dot the I? Did I cross the T? I'm worried about this person. I would allow myself to think about the patient or the day all the way to the driveway, till I got home to the driveway. And when I turned into the driveway, I had to make a mental shift that now I was not the nurse practitioner, I was a mom and a wife. And when my mind kind of slips back into the day, well, did I do this? What's coming up? We have this difficult thing, or something was very stressful, and your mind starts to go there, I have to remind myself, I'm here.
Oh, I love
that.
that.
I'm here. So that's one of my strategies that I use. I also developed a couple of sayings I will share with others that I say to myself, and visual images. So one of my visual images, it sounds kind of silly, but I imagine a duck. And I imagine a drop of water hitting the top of the duck, and that the drop of water rolls down the duck and over the duck's back and flicks off the duck's tail. So in my mind, that is a stressor. The drop of water is a stressor, and it flicks off the duck's tail.
Oh.
I also have a mantra that I say to myself, usually at work, so that I can keep myself calm. I am patient and I am kind. I'm not saying that out loud, but I'm saying it to myself so that I maintain composure, because we are human. I have emotions too. I get triggered by people. That's a way that, because I've practiced it and I've used it for so many years, it works for me.
Wow. Did you hear that? I mean, just her talking, I could see that water rolling off that duck's back and dropping. I mean, we all need to practice some of those things. And I am patient, I am kind. I love those positive affirmations that she says, because that's some of the things we need to do when we find those stressors. I love it. We got to have you back, because my God, we got like 30 seconds left. And where did time fly? But because the topic is just so vitally important to our everyday life, for our everyday health, I wanted to bring Sabrina. I met Sabrina in a business class that we were both in, and she was patient, she was kind. Now I think back, I probably was the loud one and all out of control there. She probably was diagnosing all 12 of us in the class. But anyway, it's just good to know people, their profession, know what's available. She lives down in the Southern Maryland area where I live, so it's good to know people in our area where we can go and get help and where we can refer people. So if you enjoy watching today's show, QETV Live show, and you want to get a hold of Sabrina, tell them one more time how they could find you.
www.harborsidebehavioralhealth.com. Phone number is 301-494-1009.
Awesome. And again, thank you, Sabrina, for being on QETV Live show. And like I said, we're going to bring you back. Absolutely. And we're going to bring you back. And this time, we're going to bring you back and give you the platform and just talk about, some everyday topics that you see that comes up over and over and over again, because there's nothing new under the sun. Sure. And a lot of times, if we just be a little more proactive in some of these things that are going on, we can catch some things before they happen.
I definitely invite your viewers, if they have a topic that they would want me to talk about.
Oh, that's interesting.
I would be happy to have those suggestions and come back and speak on those.
Oh, that'll be awesome. What I'll do is, prior to her coming back, we'll set it up. I will throw out some topics on Facebook and take some of the maybe the top 5 topics, and we'll discuss them, because again, it's you and we want to help you. So what better way is to listen to you? instead of dictate to you, but to listen to you and to give you that advice or that help that you may need. Again, thank you for viewing QETV Live Show with your host, Miss H, and with my special guest today, Sabrina Sepulveda. And we hope that you become the best you. God bless you. We love you. See you next week.
Thank you.